What's up guys, Dr. Sean from Active Life here. This is our movement screen that we do with all athletes before we write any kind of programming or design any kind of modification for them. We want you to know what your athlete's biomechanics look like before you have them move through an arbitrary standard. Every video that you watch is going to be filmed from the angle that we want you to be watching it when you perform it. So what we're looking for is the range of motion full? Is the range of motion limited? Is the range of motion painful? And then you can go ahead and make modifications and programming interventions based on what you find. Again, this is Dr. Sean from Active Life. We hope you enjoy it. This is standing lumbopelvic flexion. What we're looking for is to find out if the athlete can touch the ground when they just hinge at the hips and round at the back. So Veronica is going to keep her feet flat on the floor, her knees fully extended, and just reach down as far as she comfortably can. She's gonna come on back up. That would be full range of motion. So very important, when you cue this test, you're going to tell people, knees straight, reach down as far as you comfortably can. That's all we want you to tell people. If you start telling them, reach down and try to touch the floor, try to touch your toes, whatever it might be, people will find a way to cheat the test. We don't want that. Straight legs, reach down, try to touch the floor. Touching the floor is full range of motion. This is standing lumbopelvic flexion. This movement test is called ankle dorsiflexion. So what you'll see is that we've set a line on the ground. The front of this line is 4.5 inches, and in this case, the back is about 5 because this piece of tape is about 1/2 inch thick. If you use an inch thick piece of tape, you'll have 4.5 and 5.5, and you can measure men and women on the same piece. So Veronica, full range of motion for you is gonna be 4.5 inches from the upright. So what we're gonna do, set her up, no shoes on. Toe is gonna be towards the end of the tape closest to the rig, and all she's gonna do is bend this knee, try to get her knee to the upright without her heel lifting off the ground. You can see her heel is still down. Now, come on back out. Let's just go ahead and do that one more time. Go ahead one more time for him. So that represents full range of motion. So Veronica is demonstrating that she's a bit of a show off. She can go even past the rig, which is great. In some cases, people will come up a little bit short, so can you show me what short would look like on this, Veronica? Go ahead and now stop there. Now your heel starts to lift off the ground. Okay, that's fine. What we would have those people do, stand back up, we would let them know that they have full range of motion, but that we want to get an exact number. If you have access to tape, bring their foot a little bit closer and keep going until you find the maximum range of motion that they can go on each side. This test is called ankle dorsiflexion. This test is called kneeling butt to heel. It's very simple. We're just looking for passive knee flexion and ankle plantar flexion. So all Veronica is going to do is start in this tall kneeling position and sit back until her butt touches her heels. One of the things that we want to make sure people will do when they do this test to make sure it's standardized is, come on back up, Veronica. Make sure the big toes are touching for me in the back, please. Now that the big toes are touching, we're not going to miss our butt with our heels. Our feet are not going to be too wide. You're not going to be confused on the test. All we're looking for is, again, go ahead and sit back down onto the heels. 2 points of performance here. Is the butt touching the heels on both sides? And is there any space underneath the ankle? If there's a lot of space underneath the ankle where you can get your hand all the way through, we're going to be limited on our plantar flexion through the ankle. If there's any difficulty getting the heel to the butt or the butt to the heel, we have limitation in our range of motion for knee flexion. This is kneeling butt to heel. So this is prone heel to butt. So we're going to have our athlete, Veronica, lying on the floor. Hands can be wherever they want. And all we're going to do is we're going to come in, grab the front of the ankle, and we're going to drive the heel towards the butt. Always ask the person you're working with, is there any pain? Do you need me to stop? If you do, let me know before we start, right? Have a safe word. Because this is a test that if they already passed the kneeling test, this shouldn't be a problem from a knee perspective, but there might be some stuff going on in the back or in the hip that you want to be cognizant of. So again, I just grab the leg and I'm driving the heel towards the butt. First thing we're looking for, does the heel touch the butt? In this case, the answer would be yes, that's a full range of motion. Now I'm going to have you come in a little bit tighter with the camera. We're going to look for something else. Do you mind if I pull your shirt up? So we're going to pull the shirt up a little bit, and these pants are perfect. We have seams that you can see. As I bring the heel to the butt, we're looking to see if this seam moves. And in this case, it does not. Somebody who has some limitations in their range of motion in the front of their leg will see some kind of shifting away with the hips. So as it comes up, it'll look something like this. You bring it up, and perfect. And her hips run to the opposite direction, or they extend back. Can you show them what extension would look like? perfect. The whole spine locks up and everything gets tight. Some people will even experience pain in their low back when you bring their heel to their butt. So again, be careful when you do this. Make sure you're asking permission as you go along. Make sure that nothing is problematic. This is prone heel to butt. This test is called supine hip flexion. So we're having the athlete lie on their back, and we're going to be looking to see how much passive range of motion they have through their hips. Now, if somebody had any limitation on the knee tests, be careful with how you grab. We'll talk about that when we get there. So in a normal athlete, I'm going to go ahead and put my hand underneath Veronica's back. She passed all the knee tests, and all I'm going to do is drive her knee towards her chest. Now we're looking for two things. Number one, can I get her thigh to her ribs without any kind of pain or pinching in her hip? So let me know, Veronica, do you feel any pain or pinching in your hip as we go? No, she's good. The second thing I'm looking for is, does her back flatten down hard into my hand? There's gonna be some flattening for everybody, but we're looking for, like, you'll know the difference when you feel it. Someone who's aggressively pushing their back into the floor, you wanna stop when that starts. The third and last thing we're gonna look for is, it's gonna be hard for Veronica to demonstrate, but this leg will drag sometimes. Lift, and what that means is that the whole pelvis is moving and we're done with the range of motion. So full range of motion for supine hip flexion is the thigh approximates with the ribs without any kind of pinching in the front or aggressive flattening of the back. Something to note is when you do this straight on, a lot of people will have some trouble. If you bring it out a little bit, they might perform a little bit better. So just because they test limited at first does not mean that they're limited. Check a different leg slot. And be aware, both legs might be a little bit different. Lastly, if Veronica had pain in her knee when I did the knee tests with her, instead of grabbing on the outside, I would grab from the back of the hamstring. You're gonna have a little bit less leverage, a little bit more awkward, but you're gonna get the same result and you're not going to put the knee under any kind of stress. This is supine hip flexion. This test is called shoulder abduction. So all we're gonna have you do is cue your athlete to stand straight, palms facing forward. Try to, with your elbows straight, get your arms to your ears. So Veronica's gonna go ahead and bring her arms to her ears. And now what we're looking for here is a few points of performance. Number one, does the bicep touch the ear? In this case, you're finding that Veronica is actually coming up a little bit short, and that's fine. It's something to note. The next thing we're looking for is there space between the shoulder and the ear? In this case, that does exist. One of the things I like to do that I think you should do as well is come in and take a look. Can I put some overpressure here, Veronica? As I press, we can get her arms to her ears, which indicates to me that she does have the flexibility. She's just been lacking some of the mobility. And that's something that we can work on fairly easily. So bring your arms back down for me, please. I'm gonna have you demonstrate one more thing for them from the back before we move to the side. Can you bring your arms back up over your head, elbows straight, and shrug your shoulders just a little bit? What you'll see here is some people will cheat the test by doing this, and this is why we're looking for the space between the shoulder and the ear. If they shrug the shoulders, you can bet that when they go overhead, hang from a bar, whatever the case might be, they're gonna find a way to compensate, and that's gonna put them at risk for future injury. The second place we're gonna look at this test is from the side. So Sean, come on over here for me. Nope, you stay where you were. We'll have the man move, our video man. And same test, elbows straight, palms forward. Go ahead and bring those arms up over your head. Try to get your biceps to your ears. And what we're looking for here is, does the athlete cover their ear with their arms? What we'll see sometimes is people will compensate by bringing their arms forward, because if you're forward, try to bring them closer to your head now, Veronica. Much easier for her to get there. It's a totally different arm slot. So the two things that we're looking for, do they cover their ear? And in this case, that would still be fairly full. But do they cover their ear? Do they get their arm to their ear with their elbow straight? This is shoulder abduction. This test is called shoulder flexion test. So we're gonna have our athlete lay with their legs straight out in front of them. And all we're gonna have Veronica do here is try to bring the knife's edge of her left arm to the floor over her head. Perfect. Bring it back down. Let's see the right arm. Great. Now we're going to watch both arms at the same time. The reason why we start, go ahead, both arms for me, please. The reason why we start doing this from overhead is we want to make sure that the width here is reasonable. It should be jerk width, pull up width, or closer. Any wider than that, and we're not really testing shoulder flexion anymore. So we're going to move from overhead and we're going to come to the side. And now what we're looking to see is there a discrepancy from side to side? So go ahead and bring both arms up overhead again for me, please. And we're looking to see, do both of them touch the floor? Now, if you're standing on one side, it might be hard to see both, but if you have an arm that's up like this, then it's going to be pretty clear to see. The second thing that we're looking for is, did they get this range of motion through their spine? So please try again for me, Veronica, both arms. And as you come up, just show them what it would look like to extend your spine. So she extends, extends, extends. You can reach your arm all the way through, and now she's got her hands to the floor. If this is happening, this is a limited test. Full range of motion is that both fingers on both arms touch the ground. Go ahead. And there's not space underneath the spine. There might be a little bit that you can wedge your fingers into, but you're certainly not sliding your whole hand through. This is shoulder flexion test. This test is called a wrist extension. Of course, you're going to test it on both sides. We can use tape just like we would use for the ankle test range of motion, and we're going to put Veronica's fingers on the edge of the tape, which we've already pre-measured to be 4.5 inches. That's our full range of motion for women. What we're going to have her do is lock her shoulder blade back and down so that it's not moving, and we're going to have Veronica with a straight elbow. Very important that the elbow is straight. You notice there's no bend to it. She's going to try to tilt her body forward and bring her shoulder to the rig. That's full range of motion. If her heel of the hand lifts off the floor on her way in, she's going to be limited in this if you set her up at 4.5 inches to start. For men, it's going to be 5.5 inches for a full range of motion. Watch for people who are going to cheat this test a little bit by maybe twisting their body and trying to get their shoulder to it. So again, we want to make sure the shoulder is back and down, and all we want to tell them is elbow straight, tilt your body forward until your shoulder touches the rig. Any more than that, and they're going to try to cheat the test. This is wrist extension.